Assalamu alaikum. Today, inshallah, we'll talk about how to write a case report or how to report a case and this presentation or this session for the medical student. In this session, we intend to simplify our talk and make straightforward points for the medical student to enable them to report a case. And as you are a medical student, you have word, you have clinic, you have practice, and you can report cases. The important question that is, where do I find a case? So the answer, you can find the case, as I mentioned before, in your practice, in your clinic, in your ward, and your supervisor is the first one or the one who can guide you for the case report if you don't have or if you don't notice a case that is with a striking feature. The other question that you can ask about, that is, what are the reasons for publication or for reporting a case? So actually there is or the most common reason for publishing a case report as the following. So if you have unexpected association between disease or symptoms, you can report a case. If you have another thing, if you have unexpected event in the course observing or treating a patient, you can't report a case. Third thing, the findings that shed new light on the possible pathogenesis of a disease or an adverse effect, you can report a case. Fourth things, if there is a unique or rare features of a disease, you can't report it. Fifth things, unique therapeutic approaches, variation of anatomical structure also. This is one of the reasons to report a case. Now, if you confront with a case and you anticipate or you imagine that the case is much one of the above mentioned one of the reasons to report the case, you will go for the literature to confirm or refute. One thing to confirm your case is rare by reading thoroughly of the literature concerning or regarding your case. And if you find your case is really rare, you can go for your case to report. If not, you will drop your case and your case become like not a rare case or case for reporting. Now, if you find your case it is truly case for reporting, you will collect information about your case to report it at the point concerning the case presentation, and you will go for the records and collect your points regarding the history, examination findings, relevant investigations, treatment, including operative findings and outcome, and make sure that you will remove the patient information even from the radiographical or radiological images to keep the privacy of your patient. So now the other question, how do I write it up? So during your writing, you will write the details about the information about your case and the literature behind your case as introduction. You can write down in details and without restriction and without restriction with words. But during submission, you will restricted by the guidelines of the certain journal that is you contacted to make publication in. And at this time, you can match or you obey the guidelines by making trimming or trim down of or squeeze your your article according to the words that is determined by the journal. Now we come for the format regarding the case report or relating to the case report, and it is not different from the format of the original research, just in certain points, but generally we can speak about an abstract at the beginning of the manuscript, and then introduction, then there is a presentation of the case, and then the discussion, and at the end you will go for the conclusion. And for some journal you can ask you for making thorough literature review in the case of the case report and the literature review, and sometimes just you report your case as the case report. As we said, you will write down the introduction about your case or background about your case. To introduce your case, you will write down the basic information or the information related to your case, introduce your case. If you have a definition, you will make definition. If you have classification, you will write down classification and so on. And at the end of this introduction, you will determine or you will talk about your objective and why do you want to report this case in one line or in one paragraph. Afterward, you will go for the case report. Now you want to report your case as you want to make presentation of your case. For presentation of your case, you will narrate your case in the enjoyable and interesting manner. That is like generally you will talk about the history, examination, finding, investigation, and treatment. That is in order without heading, and then avoid any unnecessary details and only mention the important positive or negative findings that you want to talk about. As we said before, a positive finding, also the negative finding if there is a side effect or something therapeutic effects related to your case. And after that, you can include one or two images to keep the reader engaged. After you make presentation of your case, now you want to defend yourself or defend actually your case, and you want to say that is your case is striking, your case is interesting, your case is with unexpected feature and like this. So for the discussion or the discussion is your part that is you want to write down about your finding and what did or what do you find in the literature by going through the literature and comparing and contrast. If you have a case, you can make setting point of your cases, and actually there is like argument will convince the and actually this argument will convince a journal that your case report is worthy for the publication. And you can start briefly expanding on your introduction, explaining why your particular case is important and interest to the reader. Next, sum up the current literature related to your case by, as I said, by compare and contrast. What the findings that is you find in your case and what is literature written about, and then describe that it has already been reported about your topic, and what is the main hypothesis and theories are that explain the clinical findings. So now you have a clinical finding in your case related to your case, that it's what is hypothesis and theories that is explain these findings. And remember that is looking the reviewer when you submit your manuscript, the reviewer looking for evidence that your case is rare, but still don't make exaggeration to make evidence that is your case is report. Just you will discuss your case that is in relation to or relating to the literature. At the end of your discussion, actually you want to describe in detail the message that you are conveying through your report, and this may be in line of current thinking or even contrary to popular belief. What is your finding regarding to the popular belief, if there is any changes, um, and so on. And then focus on the lessons that you should or should be learned from your experience and how these affect future clinical practice. And it is good enough at the end also to make recommendation if you feel that is you need to make recommendation for further research to to refute or confirm your ideas behind your reporting of this case. Then you will go for the, or you come for conclusion, and you will write it down at the summary point. This point, like a brief conclusion or summary learning points. You should summarize the key message of your case report in 3 or 4 bullet points. And then you have abstract and references. Abstract come at the beginning of your manuscript or your case report, and the reference come at the end of your case report. For abstract, you can make a synopsis of your or writing of your case report, and come to the reference, and you can put the reference as the journal guidelines as the formatting required, or put it in your journal, whatever, Vancouver, Chicago, and whatever the styling of the referencing. But keep in mind also the reference for the case report. Most of the journal keep it as 10 references for case report, unless you want to make case report and review of the literature. So now the important and difficult actual step in your journey to publish your case report is to choose the journal. That is can be tricky, or certain journal, or some journal just for the case report. It is so specialized, and you can find medical journal for the case report, or international journal for case report, or British journal for the case reports, or the dental journal for the case report. It is a specialized journal for case reports. Although there is a general journal that is although it is make publication for the original or for review article, or it is for all, and you can contact the suitable journal if you will contact the journal for the medical report, or for the general journal. But still, you will keep in mind that is some journal may not favor, or may reject, or in its guidelines there is no publication for case report. So it is good enough to select your journal perfectly. While you submitting your case, there is some point you should be noticed. As before you submit your case, you will revise your case once and twice. And if you have mate or colleague, or even consultant can or supervisor can revise your case before submission, it is good. Other thing, when you contact the journal for submitting the or your case report, you will, or you may, sometime you may confront with rejection, and the rejection from one journal, it is not the end of the story, but you may find, or you will find another journal to submit your case in. And while you're waiting the decision from the journal, you will keep in mind there is no further contact, or there is no submission, there is no another submission to the another journal, unless you will get the decision from the first one. Now we have example of the case report. This is with the title auto transplantation of the third molar to replace compromised molar with the individual 3-dimensional printed ultrasonic osteotome, case report. And if you notice here, the author want to report novel or different technique for replacing a third molar or auto transplantation. This is a specialized journal for the case report from Wiley. And after the title, So this is the name of the author and institution of the author or for the author. And then abstract, as we said, at the abstract you will make synopsis, and after abstract you will make introduction and background, and then case report or case presentation, and after that you will write down the discussion and the conclusion and your reference. By doing so, this your case report, it is ready for publication. At the end of this presentation, we want to thank you for your listening, and we hope to get benefit from our videos, and we promise to make further videos and more videos in our channels. With you, Dr. Manal Abdullah Tahir. Thank you so much once again.